Good day to all our viewers at this Northwest University's webinar where the theme Social Welfare During COVID-19 will run for the next 45 minutes to an hour. We will dwell on the practical social implications of COVID-19, social justice, poverty, unemployment, and will also receive attention. On top of that, we will also concentrate on the situation of the elderly and those in retirement, old age homes, as well as the plight of orphan care. Also community-driven programs. For those not familiar with my face, my name is Pieter Moller, and I'm from the Postgraduate Student Recruitment and Marketing Department of the NWU. I will facilitate today's webinar with three very able and professional experts in their field. So just to introduce our panel to you, our panel consists of Professor Willem Jh Roostenberg. He's Professor in Social Work at the NWU, responsible for postgraduate research and also manages the PhD programs. And Meyer Conradi is the CEO of Mosaic Community Development, and also Marilyn Tron, she is Director of Bafenyi Trust. Now, if you as a viewer or a participant during the webinar would like to put forward a question, remember to sign in on your YouTube account to be able to make comments and also ask questions. So before we feature on the challenges and the problems regarding COVID-19, the social and practical implications and the impact on different communities, let us introduce our panel to you one by one, and they will also elaborate more on their field of expertise. Our first speaker will be Professor Willem Jh Roostenberg. Now, he has been a professor in social work at the NWU since 2014, and he's responsible for postgraduate research and manages also the PhD program, as I said. He's been in the academia since 1994 and worked and formerly worked at the University of Johannesburg, also UNISA. He is first and foremost a trained social worker. He specializes in clinical social work by obtaining master's degrees in clinical social work from the University of Johannesburg. And this was applied to good use in the mining industry, where he also worked as a clinical counselor, first at the Chamber of Mines and later at Anglo-American Corporation within an employee wellness context. As academic, he developed into rounded NRF-rated research, and in his capacity, he has conducted multiple research projects, publications, and research reports with various focus areas and topics over the span of this academic career. Focus areas previously addressed include alcohol and drug dependency, also interventions, diversion programs for youth in conflict with the law, youth sex offender interventions, and various community-focused research projects. His interest lies in the development of assessment scales within social work, and he believes that this will enhance the way we understand communities and the way these function. He is currently studying towards an MBA at the NWU Business School, hoping to complete this at the end of this year. And he has also served as Vice Chair of the HREC at the Faculty of Health Sciences and Chairperson of Compress Scientific Committee in the School of Psychosocial Health. It's very nice and a privilege to welcome Professor Wim.
Thank you very much, Peter, and to all the listeners. It's very nice indeed for us to be here and have the opportunity to speak on behalf of the Northwest University this morning. I would briefly like to just introduce myself by saying that I am an academic professor, yes, but we are conducting some very interesting research at the moment during this very difficult time. So just briefly, what we are trying to do at the Northwest University Department of Social Work is that we are trying to do research in mainly two areas. The one is in child protection, and then specifically also in forensic social work. So those are the two main directions of research. So what we are doing at the moment is we have a project in which we are developing a scale for measuring the best interests of the child in a South African justice system. So we are trying to monitor what extent is government and the state in a position to provide for the best interests of the child. In our opinion, this is a very important project that can make a huge contribution to our understanding of how well children are cared for in the justice system. We have also recently completed a research project on the Rhythm of Life Youth Diversion Program. It's presented here in the Northwest province. And we have several research projects at the moment running on assessment instruments for measuring child protection in various stages of interventions in that field. We are then specifically involved with the University of the Western Cape in a joint collaborative research project on family well-being under circumstances of COVID-19 lockdown. This will be a very interesting project to see how do our families cope under these circumstances, and how do, let alone how do they flourish under these circumstances. Our research center through which we conduct our research is called COMPRESS. It's Community Psychosocial Research, and we have plus minus 20 to 30 researchers who are active in this research unit. Peter, over to you. Thank you.
Thank you very much, Professor Wim Roostenberg. We're going to move over all the way to Wellington. Meyer Conradi is a real brand ambassador for the NWU in terms of postgraduate studies, where he obtained his M degree. Him and his wife, Louise, she's a qualified social worker, also as an alumni from the NWU. So Meyer's passion for orphan care collided with his fascination with numbers when he did his master's degree thesis at NWU on the efficiency of different orphan care models, realizing that orphan care organizations can be more efficient if they use data to inform decision-making. Meyer and his team developed OVC measure, and he will tell us more about that later, an online monitoring and evaluation system built for orphan and vulnerable kids, child care organizations around the world. So with this OVC measure and Mosaic's unique orphan care model, Meyer and his management team now help other individuals, also organizations and churches, to establish and grow their own orphan care initiatives into sustainable organizations that can efficiently address the massive orphan care crisis in South Africa. Beyond his work directly with the Mosaic and OVC measure, Meyer also serves on the board of a number of businesses that Mosaic holds shares in. So great, and it's a privilege to welcome you, Meyer.
Thank you, Peter, for inviting me to this conversation. It's indeed a privilege to be here this morning, and I'm really looking forward to the discussions and the questions from our viewers. And yeah, just a little bit more about the organization that I'm working at. Peter, you touched on my wife being a social worker and both of us studying at the Northwest University many years ago. We met at the Northwest University, and we both had a passion for orphan and vulnerable childcare. And that passion actually led to us starting our organization called Mosaic when we were still students. So in our final year of studies, we started the organization when we learned about how many orphan and vulnerable children there actually are in South Africa. And when we saw this massive number of children in need of care in South Africa, we looked at the need that's out there, and we looked at the solutions that was out there at the time. And what we've realized is that Africa inherently has an amazing solution to orphan care, where if a child becomes an orphan in one of South Africa's townships, or for that matter in Africa, they end up with their extended family. Now, if you look at it from a scientific point of view, that is the ultimate best place for a child to be at, is with his extended family, if his parents are not around to take care of him. The second best option would always be with extended family. So we have built our entire organization, Mosaic, around that, call it phenomenon. So as an organization, we focus on supporting families, usually grandmothers or aunts, who are taking care of 2 or more orphan and vulnerable children. So as an organization, we have community centers based in Ikageng, just outside of Potchefstroom. We have a second community center in Wellington, and then a third community center in Port Elizabeth. And through these community centers, we serve families who are doing orphan care. We serve them by helping them to get a job. We do social development with them. We focus on the children's education and their academic development, literally from when they are born all the way through university. So yeah, as an organization, we've existed now for 12 years, and we operate in these 3 locations. But Peter, as we've mentioned, is our heart and our dream is to see that the standard and the quality of orphan care around South Africa is raised. And we believe we can play a role in that by serving other organizations and individuals who want to do the same as we do. And the way that we serve them is, through systems and processes that we've developed over the years, but also very specifically through the software that we've worked on for the past 2 years, and to help organizations to monitor and evaluate what they are doing so that they can make decisions with regards to interventions based on data and not based on emotions. So yeah, that's us in a nutshell.
Thank you, Meyer. Really interesting, and we're looking forward to hear more about Mosaic and the developments and all the projects that you're involved in, and we'll speak about that later. Our third member of the panel is Marlene Tron. Great to have a lady on our panel as well. And Marlene is director of Bafenyi Trust. That is several projects also with support systems in the communities of the Northwest province, especially in Ikageng. Bafenyi Trust, it's a non-profit organization operating, as I said, in Ikageng. And it's a Tswana word, Bafenyi. She'll tell us more about that, for winners. And their vision is to see people win regardless of their circumstances. Bafenyi believes that through their programs, they can bring hope and love to the communities that are in desperate need of it. So yes, great to introduce our lady of the panel, Marlene Tron.
Thank you for having me here, Peter. I appreciate it so much. I love this webinar that's going on, and I feel like it's such a good idea to bring light to the issues in nonprofits at this moment during COVID-19. So like you said, Bafenyi is a nonprofit organization in Ikageng, just outside of Potchefstroom. So in 2010, we started as an organization which focuses on building of ECD centers, but we saw a lot more challenges in Ikageng, in our communities, and so we decided to do something about it. So like you said, Bafenyi is the Tswana word for winners, and we want to see all people win regardless of their circumstances. So we believe that our programs, we can bring hope and love to the communities and to the people who need it most. So we have 5 programs at the moment. We have a training and support program for ECD centers. So we make sure that the ECD practitioners have the skills to develop their children to the best of their abilities. These ECD practitioners usually doesn't have any sort of education surrounding childcare. The next program, we have a community program. So we focus on community development, and we have a feeding scheme running to make sure that the communities that's the poorest of the poor have enough food and are developed as well. Then we have a program where we focus on facilitating networks and partnerships for community development. We partner with local and international universities and schools, and we make sure that the community gets the correct help that they need. The next one is poverty relief. So we touch a lot of social cases there. We help where help is needed. We usually help with IDs and birth certificates to make sure that the kids can go to school to get that formal education. And then our last program is our kids clubs, where we focus on primary school children to make sure that they're off the streets and safe after school.
Thank you very much, Marlene. Very interesting, and I'd like to hear more about the kids clubs. Thank you to all our viewers as well, participants. I already see a lot of questions. Rosaline, Memphis, everyone sending in their questions. We'll handle that a little bit later. I'd like to start off with Professor Jh Roostenberg. The impact of the lockdown at this stage, the day-to-day operations. Could you focus on your goals and needs? Did you have to change your strategy, and also how the isolation prevents interaction with COVID? Could you elaborate more on that, Wim?
Certainly. Thank you, Peter. Yes, well, let me start. I think everybody by now is aware of the fact that COVID-19 is indeed not only a health issue, but it is also a major social issue for all of us. And it is actually quite paradoxical to think of it, that this illness, this condition has hit us hardest in our social spheres and the way we as individuals function, first of all. So let's just develop a bit of a perspective on how this illness affects all of us. And we need to think of ourselves as being part of a very large social system involving a lot of different networks that we are involved in, organizations, patterns in how we socialize with other people. And it is just so sad, actually, that this illness has caused us to cut down and to cancel a lot of our networks. I think this is something that we need to think of very carefully, especially when we think of children who are vulnerable, but also families who can be vulnerable in these circumstances. Essentially, the lockdown has caused all of us to scale down on our social relationships. We're actually being forced to cut down on contact with other people. Now, for people like myself, easy to do that because I can quite effectively function in the constraints of my home, and having my family with me, it is quite easy to still do what I'm supposed to do on a daily basis. We need to think of what happens in the case of poor and vulnerable families where unemployment is rife. These families certainly don't have the privilege to have privacy in the house because their houses are small. And we find that self-isolation and lockdown is a different concept in vulnerable communities. We also find then that because people are forced to stay together in a relatively small area, their boundaries between individuals become fragile. So it is very easy for emotional problems, conflicts, difficult situations to spill over into different areas in the family. So where before I could still manage my own emotions by leaving the house, going out into the street or visiting somebody, I don't have that privilege now, and I have to deal with my own emotions, my own crisis, my own issues within the constraints of the family. And we find that this is quite a risky situation in many contexts. Also, the whole idea of being isolated means that people get lonely. They develop a kind of an anxiety for being alone and by themselves and not having contact with other people. The consequences of that isolation is that I begin to doubt the realities of my situation. This leads to all kinds of psychological issues, such as that my own self-image deteriorates. I become depressed. I begin to develop fear. And part of the whole issue here is that the psychological condition thrives in conditions of isolation. So when people are isolated, are no longer able to socially connect with other people and with support systems from their environments, it indeed causes a lot of psychological distress, and this influences the whole family. So from this very brief background, I think we need to understand that this social disease, COVID-19, is actually a social disease, and that it will definitely contribute to a lot more psychological and psychosocial health issues that we haven't had before under normal conditions. And lastly, people who in any case do not have employment will find it very difficult to survive under these circumstances. And this is the second impact of the COVID-19 crisis, is that it hits us on the economic side. South Africa in any way is not a country at present. We actually have a lot of economical problems. Due to the COVID-19 onset, these problems are just made worse. And it hits the heaviest at the poorest of the poor. If you are poor, you are unemployed, you're actually dependent on your social contact with your environment in order to get employment, to find a job, to find an income that can put bread on the table. So with organizations closing down, businesses being in a lockdown situation, job opportunities are very scarce. And for the poorest of the poor, you have to be out there in the community to find a job, to be considered for employment. So if you are isolated at home, there's no chance of you going out and finding a job. So what happens now is you go out into the community, you go and look for a job, you go and look for income, and then that actually increases your vulnerability and the chances of being infected by COVID-19. So we must understand in these days how intense the COVID-19 pandemic has hit us all one way or another. So this is just briefly the background that I want to stress. The question that probably remains for all of us is, how do we cope with these circumstances? How do we ensure that we still have a healthy relationship with friends and family members? And how do we ensure that we can survive this as individuals, but also as families? How can we still thrive in the conditions of lockdown? That's probably the most critical question. So that's the kind of background and the kinds of things that we have to think about when we address this topic today. Peter, thank you for now. Do you think that is kind of a good introduction here for today?
Thank you, Professor Wim. I think you're loud and clear, so thank you very much for that introduction. Right, let's move over. I think let's talk to Marlene. Marlene, the same question to you. We saw the social interaction that promotes the spread of COVID, and your organization. How do you deal with these? How do you deal with the impact of the lockdown?
Thank you for the question, Peter. So first of all, our organization focuses and works with big groups. So none of our programs can stay the same because we are not able to work in these big groups. So from that point of view, we have to change all our programs to fit in with the new rules and regulations from the government. So on the one hand, we really would like to make sure that the people of our communities get the help that they need, but we also want to make sure that they are safe and they're not vulnerable and for COVID-19. So it kind of put us in a difficult situation. So during this time, we had to adjust all our programs to make sure that we still have an impact on our communities and make sure that they get the help that they need, but make sure that they are also safe. And the communities we live in is usually by pace. So it is really informal settlements, an open piece of ground where everybody just put up a shack or a makuku. And there's no running water, there's no electricity. The houses are really close to each other and they have such a tight-knitted community and they depend so much on each other, not just for emotional help, but also physical and food and everything like that. So with them being isolated or have to stay indoors, it makes it almost impossible for them. They need to go outside for water. And social issues inside the houses are building up and up and up and up. And they need to visit friends and they need people to talk to relieve of all the stress. So at this stage, it's really difficult for us as an organization to make sure we reach our communities and to make sure that we help them and give them the help that they really need.
Thank you, Marlene. And just at this stage, we would like to welcome all our visitors and from overseas. We have a lot of viewers from overseas, from the Philippines to the USA to Sweden. Hardy word of welcome to you as well. Maya, we lost the signal, but you're back and we're so glad to see you again. Just on your side, the impact of the lockdown, the day-to-day operations from your side?
Yes, yeah, Peter, I think it goes without saying that we are all heavily impacted around the world by COVID-19. For us as Mosaic, doing most of our operations from a community center, etc., we obviously had to close down our community centers until we reopened them. We are phasing some of our programs which we did. I think with regards to our core vision, we are trying as much as we can to continue with those, but doing it in a very creative way. Because we can't bring all of our children back to the community centers that we are looking at and have actually already piloted in some of our communities a setup where we deliver tablets to the home of the children and then we tutor them online through a Zoom or through like a WebEx meeting or something like that. Yeah, so with regards to day-to-day operations, severely impacted. Trying to stick to the original vision and mission, but doing it in very creative ways.
Thank you, Meyer. Professor Wim, I'd like to ask you, and you've heard what Meyer and Marlene said, what is the industry's major, the bigger challenges at this stage? And how do mental health, well-being flourishes in social interaction? And what's the effect on the sector?
Yes, Peter, I think that we must realize that isolation is actually what we are supposed to be doing. But we have found in social services and in social work services that it's actually impossible to do your work over the internet, so to speak. The interesting thing is, for instance, my wife is also a social worker. and she does counseling online for a company in Johannesburg, and I've had a tremendous increase in the need for counseling with people. And most of the issues that are being dealt with nowadays have to do with the impacts of social isolation. You can imagine if there's been a pending marital problem or family problem, you have suspected your partner to have had an extramarital relationship, for instance, then this kind of situation may begin to brew. And it's brewing in that family, and it's causing stress into conflict. So a lot of the work that is being done today is to help people to live with the effects of lockdown, living under the circumstances and still dealing with your problems. It was rightly said that you actually need to have contact with others. Now, the workplace, for instance, becomes a point of reference. We all think we just do work in order to earn money, but it's not like that. The work environment becomes a place of support. It's a place where you gain perspective on your situation. And being deprived of that takes away a lot of your meaning in life. So for poor people who don't have jobs, this is just as severe. There is a phenomenon that we know in South Africa that people do the effort. Some people do the effort to go and find a job. That's not the real unemployment. If you are still looking for a job, but if you have stopped looking for a job and you stay at home doing nothing, that is the real unemployment, which is psychologically unhealthy. So a lot of the services provided by social workers at this time is still conducted live. Most of the organizations we have contact with continue virtually as if things were the same, as if there is no lockdown. And actually they are also in a kind of an essential services category. Of course, they need to make sure that the risk for spreading COVID are being dealt with sanitation and with wearing masks, etc. But a lot of their work continues. So what is this work that they are doing? It's the basic income grant, which is now being considered to be implemented permanently after October this year. That 350 Rand may not sound like a lot of money, but for many people who don't have any income, will at least ensure them to have a decent meal. So feeding schemes under these circumstances is a very important component. And the Northwest University, the Department of Engineering has started this project where you have a self-serving feeding scheme by means of like an auto teller. And this is one attempt that the university is using to bring food to people who are in need of food. So basic support in terms of food and a feeding scheme is critical for the circumstances that we live in. Then the other aspect that needs attention is we need to look after the children. Children are at their most vulnerable in dangerous crisis situations within families. So our social workers need to be up to date and very critical by reaching out to families, vulnerable families, to ensure that they are aware of cases where children are destitute, are being neglected, or may even be abused. So awareness in that respect is very important. Many social workers still operate and work within the constraints of the community. Of course, that makes them more exposed and vulnerable towards contracting COVID-19. But this is the only way that they can reach out to vulnerable families who live in the community, who are isolated, and who need to get support. I think the one important thing that we all need to have is we need to have at least virtual contact with our friends. In some way, we need to reach out to the community, whether it is to the church, to our friends, to people we know. We need to maintain some form of contact, even though we are no longer visiting. Basic contact with other people is necessary to counter the effects of psychological anxiety and all the other negative psychological effects of the lockdown. So if anything, that needs to be part of your routine, is how are you going to maintain contact with other people without risking contraction of COVID-19. And then lastly, you also need to fill your day with healthy activities. There is this concept of resilience, which means the ability to stand up under very difficult circumstances and make plans to survive. So making plans is very much what we need to encourage by our interventions. We need to reach out, help them with devising plans, how to survive this lockdown, how to get out, how to still find employment under these circumstances. So personally, I'm very glad that at least businesses are able to operate, although it is still in limited capacity. But we need money to be spent in the economy in order to get it to move forward. So the more we can come back to normal, if that is possible, the better. Another aspect I want to address is the fact that we say that South Africans are not very compliant with lockdown circumstances. And this is to be understood, considering what we've just said about isolation. But compliance is something that comes with time. So I think a lot of our efforts towards communities should be to help people to live safely under these circumstances and deal with it effectively.
Thank you, Wim. Wim, he mentioned the importance of social gatherings or social interaction. Marlene, over to you. And I'd like to ask you, also, he said the children are vulnerable. And do you find in your organization and the projects and the communities where you work, the emotional effects that it does do harm to the communities? Do the children understand the whole pandemic?
Thank you for the question. And I think it's a big part of isolation at this moment is the effect that it has on communities. Because communities so rely on each other, like I said, emotionally and physically, but now being isolated, they don't have that support and they need to start and handle situations and problems on their own. And they don't have the skills to do that because of the community that they are in. And especially the children doesn't know what's going on. The information inside of these poor communities are really bad. The government, according to me, didn't do enough to make sure that people without electricity, without any internet or information knows what's going on. They have no idea what is COVID. They don't know how to handle it. They don't know what's going on. And I think that plays a bigger part in the fear in the communities at this moment. It's because nobody told them that this is the actual situation. So especially the kids, they think they have just a really nice vacation and they don't know how to handle it. They don't know what's going on. They see their parents lost their jobs. Their parents are at home the whole time. And they don't know how to handle it.
Thank you for that. We have an interesting question, and I think I'm going to ask you, Wim. Yolande asks, she's a primary school teacher, and one of her grade 7 learners committed suicide which is very sad, and it's ripped through the heart of the school community. Extremely frustrating also because they feel cut off from the learners, the teachers, and not all learners are reachable. And you spoke about virtual contact, at least. This is very sad side of the reality. How would you address this?
Yeah, this is a very important question. I think we deal with these situations almost on a daily basis. A child committing suicide under these circumstances is a very, very sad thing. We must realize that population are so destitute. If I can use a similar example, we go back to the Second World War, where people were in concentration camps. And there were circumstances, those circumstances were so bad that we found that people would on a day just run into the electric fence in order to kill themselves. And this speaks to the whole idea of meaning in life. Somehow, if you have something to look forward to, something to still keep you going under very difficult circumstances, that would be one way to survive circumstances like this. But the problem that we have as social workers, as psychologists, as even primary school teachers, is the fact that we don't know what is going on inside the families of our community. We don't know what is going on behind closed doors. So we have no way at present of identifying people who are in need, people who are severely depressed and will actually commit suicide. So if anything, there is one thing that we can do, and that is to ensure that as volunteers or as community members, we are able to reach out to people in need. There must be some way in which we can advertise in communities who the people are that can provide support. We need volunteers to go out into the community and reach out to families who are vulnerable. It's easy to say we can do this virtual and we can make available a website here or a telephone number there. But the harsh reality is that a number of people and families do not have, they cannot afford to buy Wi-Fi, for instance, or have airtime even. So it is going back to the basics of reaching out to vulnerable communities, making sure that families who are in need know about the services that can be rendered by social workers and voluntary organizations such as who are present today. So that would be the first step, is reaching out to vulnerable people. Providing support is the second most important thing, is just talk to people who indicate to you that they are depressed. Just allow them to speak about their emotions. And that in itself may already be a supportive function. Of course, if you are at the level where you consider suicide to be the only option, you actually need medical intervention. If anything, that would be the next call of duty, is to get someone to a doctor, to a hospital, where they can at least get some form of medication. But most important, all we can do as teachers and as professionals in the community is to provide support, first of all.
Thank you, Willem. Thank you very much for that answer. I'd like to move over to the economics and how economics promote well-being and how well-being promotes economics. Over to you, Meyer. As an NGO, and I presume that you obviously support the broader objectives of the government, that's the Department of Social Development, or do you differ somehow on the how and the when?
Peter, just to make sure I understand your question correct, is what do we think about the government's approach with regards to the economics, and what is our approach with regards to economic relief at this time?
Yeah, the government's approach towards you as an organization, and also the issue of funding. Is there enough? There will never be enough, but how do you deal with that?
Yes, Peter, I think I would like to throw a bit of a curveball back at you and say we always hear that there's never enough, but I do believe that there is enough. What I believe parallel to that is that yes, there is enough, but the ways that all of that money that is available and that I believe is enough to make a difference is just not getting to the place where it's making a difference. And I think the government's relief efforts, are commendable, but it's not getting to the ground. I mean, the social grants that was instituted and put into place, I'm having a tough time hearing on the ground from people on the ground who's receiving that. The people that I'm talking to and that our organization are working with are not receiving those grants. Businesses that we are in contact with who's supposed to receive money from UIF to pay salaries at the moment, are not receiving what they are supposed to be receiving, and they are receiving it very late. So I think it's not the question is not, is there enough money out there? I think, are our systems good enough to get it onto the ground? Now, I've always been a firm believer in grassroots organizations. And I think it's difficult for an organization or a body as big as government to make sure that the money actually does get to the ground. And I think there should be a higher level of collaboration between government and grassroots organizations to make sure that the benefit that is available, the money that is available, that it actually does get to the ground. And that effort hasn't been very big from government side. I'm sitting on a number of different forums, especially during this COVID time, where we as a non-profit community are constantly talking to each other and trying to find ways to get through this interesting times that we are living in. And what I'm hearing on all those forums is that very few organizations are actually finding ways to work with government. And it feels like, and I might be wrong, but to me and to our organization, it feels like government is not very willing to work with us on the ground. And despite the fact that we are approaching them, we are not getting a lot of joy there. But the good news is at least that the private sector is standing up. International aid organizations, are coming to the party. So we do as an organization, and I've heard this from other nonprofits in South Africa, especially working with vulnerable people groups like children, we are receiving help. So it's not like, like the wallets are closing up everywhere from all around. At least there is some help that's flowing through from private corporations, from individual people, and especially from international aid organizations.
Meyer, thank you very much for that positive news and something to look forward to from funding outside. I'd like to ask Marilyn as well, the issue of funding. How did it affect your organization as such?
So during this COVID-19 situation, we focused a lot on our feeding schemes to make sure that even though we can't reach the people directly, we can still make sure that they have something to eat, something on their table, to make sure their kids are fine. So with regards to that we were really blessed to receive also a lot of donations, like Meyer said, from individuals, companies, and from overseas, to make sure that we can at least feed our communities. But I also wanted to agree with him with regards to Department of Social Development and the government, the money is not getting to the ground. They have the money and their plans are really good and in place, but it doesn't reach the people who really needs it. Especially, we work a lot with ECD centers, and they have been closed since March. And so they have not received any funding from social development. So most of the schools need to shut down because they can't pay their rent, they can't pay their teachers. And so it's really sad because the money is there, but it's not being utilized or given to the people who really needs it. So there's a positive side, but there's also a big negative surrounding funding at this moment.
Just to add on there, Meyer, I'm going to ask you, there's a question, thanks Palesa. She says there's a lot of issues concerning families who need help during this time, and how do they access food if they aren't working? It is really tough out there. How do you cope? How do you help her? And I know that it's a big question to ask you, but how do you cope as an organization to feed the people?
Yeah, I think, Peter, that is a difficult situation. And, there's this constant debate between lives and livelihoods. And I think this is a great example because a lot of jobs are lost. I read an article yesterday again about Consult Glass, who's cutting back and not being able to pay people because of the job losses, because of the alcohol ban, and alcohol uses glass containers, and there's just so many. That's just one example, but there's so many implications of COVID and the lockdown, and people not having jobs, and where it hits hardest. And I always say this to our donors: is where it hits hardest is with the poorest of the poor. I mean, the people in the South African townships are called vulnerable for a reason, because they truly are vulnerable. And in a crisis or a pandemic like COVID-19, you and I, we maybe have a savings account that we can go to if we lose our job, or we maybe have a mom and a dad that we can run to, or a brother or a sister who's in a good situation. But when you're living in the townships, it gets to a situation where it's literally, do I have food to eat tonight? Now, I know that there's a lot of organizations and even ourselves, under normal circumstances, we don't do food parcels. Under normal circumstances, we wouldn't hand out food in the communities. But we've realized in this current situation, we would be reckless and careless to not hand out. Now, most of the families that we work with at Mosaic, most of them are fortunate enough that they are in jobs where they continue to get salaries and pay. But what we've realized is the burden on those families, even though they kept their salaries, or they were still receiving their salaries, all of a sudden their extended family maybe lost their jobs, and their extended family came to them because now all of a sudden they were the ones who have, and now they are the ones who can provide, food to a bigger group of people than that they used to be providing to. And because of that reason, we made the decision, and I know a lot of other organizations made that same decision, to say that let's just get food on the tables. We are very aware that a lot of people have lost their jobs. Let's get food on the tables. Now, unfortunately, and I think maybe this is trying to address Palesa's question. Unfortunately, we can only work with the people that we know. We can't drive into the community with a truck full of food and just start handing out food. There's a lot of safety issues regarding that, but also a lot of other social reasons why we wouldn't even consider doing that. We can only work with the people that we knew before COVID, whom we have already established relationships with. And that for us as an organization is where we focus. Now, we might give food or more food than what our families need and encourage them to hand that out to people that they know are in desperate need. And we've seen that actually happens. But that's unfortunately where us as organizations, our hands are somewhat tied. to only focus on the people that we already have relationship and trust relationships with.
Quick in a nutshell, and I'd like to ask Professor Wim the question from Derek, and it was mentioned about the alcohol by Meyer, and he said, Derek's answer is, or not his answer, his question is that the impact of alcohol and tobacco ban on the clients, is it positive or negative? And there's also a question around the mental health of people. There's a social worker at Children, thanks Caro, at the children's home. The experiences and the same effect on the children in their cases. The well-being, it's a big task for the pandemic and especially for the lockdown. In a nutshell, could you perhaps quickly answer that? It seems to me we lost contact and the signal there. Maybe Maya, from your side, and I know that you work with a lot of vulnerable communities as well. The impact of the alcohol and tobacco ban on the clients, is it positive or negative? How are people coping?
Yeah, Peter, that is a very hot topic and probably a sensitive one, because I think many people can agree that there is sense in banning alcohol if you look at the impact that alcohol misuse and abuse has in the communities that we work. Okay, so from that point of view, yes, it makes sense. But there's also a flip side to that coin. And this is, as in with most things in life, there's always a flip side to the coin. And the flip side to the coin is the number of job losses. Now, I live in Wellington, which is in the heart of the winelands of the Cape. And our association with wine is not just all the bad stuff, and the effects that it has when it's abused. But our connotation in the winelands is it's a job creator. It's putting food on the table for vulnerable communities whose only income in an entire family is that one job that they have with the wine farm. So I think, there's always two sides to the coin. That yes, the ban definitely does make a difference in the sense that there's less abuse in the community. We don't work with alcohol abuse a lot often in our organization and the beneficiaries that we work with. So we haven't experienced this firsthand. So I might not be the best guy to answer that, but that's just my personal take on that.
Thank you, Meyer. I think, did we get the signal back from Professor Wim? Otherwise, I'd like to conclude and ask, maybe just for you and Marlene, Meyer, do you cooperate well with other NGOs as well as the department?
Peter, a real quick answer to that is that COVID has, to a very large extent, forced us to work together as non-profits. And I think that's probably one of the best spin-offs of the COVID-19 pandemic. And I'm very excited about that spin-off because I think in the past there was definitely some collaboration, but that collaboration definitely increased amongst non-profits because all of a sudden we had this common enemy and we had to address that very aggressively as a group and as an industry. As I've mentioned before, I don't think that collaboration necessarily includes the department and the government as such. But again, that might be just the experience of the groups that I work with in.
Right, just to conclude and ask Marlene, opportunities. How do you get involved in societies? Is there opportunities? Is there some positive news out there?
Yes, there is definitely positive stuff out there. Like Meyer said, NGOs working together, working with the university and different departments. And there's so many people reaching out that really wants to help. And I think that's such a positive thing, is that it's bringing a lot of people together to make a difference and to make an impact in the lives of people who really needs it. And the opportunities that's there is to think outside of the box, or to think inside of the box and inside of the regulations, and think creatively on how the project is going to survive and how the project is going to make a bigger impact than it's already making, but within the guidelines. And that's the really exciting part, is that an organization can grow and develop and grow bigger, but think creatively about the programs and change the programs to make sure that everybody still gets the help. Yes, so I think it's really good in a sense, and I think a lot of organizations are going to grow and develop in COVID-19.
It's so great to hear some positive news. Maya, I'm going to, before I ask Wim to conclude, I'd just like to ask you, listening to you today and your passion for your work, am I right in saying that one can still live your dreams and passion in the workplace in South Africa?
Absolutely, yes. I think you definitely asked the right guy that question. I'm personally very passionate about South Africa. And I think there's still a lot of opportunity here. And, you know, again, under difficult circumstances, it brings out not just the bad in people. You know, I've actually, under this very difficult circumstances in the past couple of months, I've been overwhelmed by people's goodness, people's willingness to help their fellow South Africans. I've been overwhelmed by, you know, people just coming to the table and say, what can I do? Like Marlene was saying, but not just asking that question, but then actually going over into action and doing something. And when I see people doing good things, that gives me hope, because as long as there's good people out there doing good things, we can still, we can still see some good things happening. I guess that's the message.
Thank you very much, Meyer. We appreciate also that positiveness. Professor Wim, just to conclude in a nutshell, for prospect students, which are the opportunities, or what are the opportunities? Is there a wide scope of focus on or in social work postgrad studies? Did we lose the signal? It looks like it. Maybe just from our side, for postgraduate studies in social work, there's a lot of scope, and also Professor Willem will tell you it's in child protection, master degrees in social work, child protection, also a lot of applications that we are waiting before the 30th of September. So please, if you want to apply, you're more than welcome. The content of today's webinar will also be available on various social media platforms. But certainly, most important of all, you'll be able to find it on the NWU YouTube channel. Thanks to our speakers, Professor Wim Roostenberg, Meyer Conradi, and Marlene Tron. You really gave us an insight on the challenges that lie ahead in the future of social work, community development, and more. And remember, if you would be interested in furthering your postgraduate studies at the Northwest University, do not hesitate to contact us. And I think there's so many questions still to be answered, and we are really planning to hold another webinar on this topic. So thank you very much for your participation and the viewing, and we trust that you will stay safe. God bless.